Hi, my name is Ruby Blois. I've been a colleague and friend of Nuala Kenny's for almost 40 years. It's hard to believe. I first met Nuala when she was a resident at the Children's Hospital. And in later years, Nuala and I have been able to do some golfing together. And I bet most of her colleagues are not aware that she shoots a mean ball, where she shot a ball at least 250 yards. On a personal level, Nuala's been a tremendous colleague and friend. So Nuala, God bless, take care, and I look forward to having some fun times with you.
Hi Nuala, Rick Nurse here. Truly sorry I couldn't be with you today to celebrate your wonderful career and all that you've done. Whenever I think about our time together, I can only think of a description of Nuala Kenny as the most thoughtful person I've met throughout my career. And I mean that in both senses of the word. You, as we work together at the IWK, your thoughtfulness in the approach to people that you worked with and to issues that we dealt with together always served as a reminder to me on how we're expected to approach the challenges in life. So thank you so much, and all the very, very best to you.
Nuala had a vision. She was starting with next to no resources, and she understood that it was going to be a small unit, but it was sort of like this thing that we can still be mighty. And it was really wonderful to sort of have opportunities to sit down and to vision with her. What could we be? Where would we be in 5 years' time? What could we do with the little resources that we had that would be different and allow us to make a mark and make a difference? It's always exciting to be around when somebody has that kind of grandiose plan for the future and invites you to be part of it.
Hi Nuala, this is Jeff Kirby. Major congratulations on your quasi-retirement and exciting new venture. I wanted to thank you for a couple of things specifically. One is for sharing your wisdom so generously to me and other members of the Department of Bioethics. Another is your passionate commitment to publicly fund healthcare in Canada and being such a champion in this realm. On a personal level, I'd like to thank you for the opportunity to practice healthcare ethics at Dalhousie. And I want to thank you for your sense of humor, which works so well with my twisted one.
Hi Nuala, it's Christy Simpson. One of the things that I wanted to say to you at the time of your retirement is how much it's meant to me about your connection with the community and with the healthcare system. Because without you, I wouldn't be working here today. You're the one that helped build the collaborations with the IWK and Capital Health and really saw them off in the early years and got them going. And it's through your continued support that we've been able to develop into the Nova Scotia Health Ethics Network. But the other thing I wanted to say is really just how much I laugh sometimes when I see those Viagra commercials on TV, because I can picture you dancing down the hallway in bioethics singing good morning, and dancing around in that kind of way. And I think that's a fun way to remember you and think of you and into the future as well.
Hi, I'm Jocelyn Downey. As a Canadian, I think we actually all owe her a debt of gratitude for the way in which she has fought and led the charge to protect the Canadian healthcare system. And so it's great that we have somebody who's as charismatic as Nuala leading the charge on this, because we're going to need as much charisma as we can to get as many people following as we can to protect this. It's an essential piece of who we are as Canadians, and it's also essential for justice in Canada. Personally, Nuala's been a good friend to me. We've had an enormous amount of fun over the years. She loves to laugh, and she enjoys life. She's so light that she makes other people lighten up, and sometimes I could get too serious and so on. And so being around Nuala, she just sort of shakes you up, and you shake everything off and just relax, kick back, and have some fun.
Hi, Nuala. It's Lynette Reed. I really think of your legacy for not just this department and this faculty and this university, but for bioethics in Canada, consisting in this amazing achievement of creating really an academic unit, a department of bioethics in a faculty of medicine, which brings to the community locally and nationally such a wealth of solid expertise in this area. The more embedded I become in the faculty of medicine, the more I appreciate what a phenomenal achievement it was to have created something like what we've become. The way that you keep us all in bioethics in Canada focused where we should be focused, on the big picture, on the systems that create the injustices and the possibilities for justice in healthcare. And that's where our eyes always need to be, and that's where you always keep us honest, and I'm sure you'll keep doing that in your retirement.
Hi, this is Janice Graham. I think it was the spring of 2001 when I got a call from Francoise asking whether I'd be interested in joining the bioethics department at Dalhousie. I was sitting in my office at UBC overlooking the Pacific Ocean in Vancouver. I thought, why would I leave this? What sort of view would I have? Then I met Nuala, and the view was of a public health system that was responsive to the social determinants of health. I knew I'd be heading east, and I've never looked back. Nuala's built our department on passion and no doubt some amount of prayer, and because I know she's not likely to be retiring really, I'm looking forward to regular infusions of that passion and prayer from her in the years to come.
I had no career goal to go into government at all. I was actually asked to help in a situation where they had had a rapid turnover of deputies in a very short period of time. The exact request was for 2 or 3 months or until an election. It was a minority liberal government at the time. I figured that I would learn more about ethics and health policy in a brief period inside that position than I could ever learn from a book. And besides that, I had this strong sense of civic responsibilities.
Nuala Kenny. As a valued member of the academic, medical, and religious communities, her contributions have had a profound impact on the quality of health care for patients and their families. Active within the medical profession, she serves on a multitude of committees and brings to each her exceptional skills as a communicator, administrator, and clinician. An authority on bioethics, she is recognized nationally as a leading educator in this emerging field. Her many contributions to pediatric health care, ethics, and teaching have left an indelible mark on Canada's medical community and inspired many young physicians to follow in her path. Sister Kenny.